teleconference this afternoon, we will have a debate between the surgical residents from the teleconference this afternoon. For our teleconference this afternoon, we will have a debate between the surgical residents of the Philippine General Hospital and the Zamboanga City Medical Center. Before I spell out the format of the debate, I will introduce the audience in Manila and in Zamboanga City who are attending this teleconference. Here in Manila, we have the following surgical residents from the Philippine General Hospital. We have Bong Bajao, fourth-year surgical resident. We have Dr. Louis Agno, another fourth-year surgical resident. We have Dr. Giselle Catalan, a fifth-year surgical resident. Dr. Sam Balo, first-year surgical resident. Dr. Ricky Quintos, a fourth-year surgical resident. Dr. Caroline San Arcilia, a fifth-year surgical resident. Here also in Manila, we have a judge, a resource person, and a reactor for the debate. We have Dr. Michael Liquete, the former chief of the division of the head and neck, breast, soft tissue, and esophageal surgery of the Department of Surgery of the Philippine General Hospital. With us here also in this room are the third-year medical students from the UP College of Medicine. I'd like to introduce myself too. I am Dr. Reynaldo Coson, the director of the General Surgery course which have been conducting in Zamboanga City since 1991. I am also presently the chief of the division of head and neck, breast, soft tissue, and esophageal surgery of the Philippine General Hospital. I will serve as the primary moderator in this afternoon's debate. To help me moderate in Zamboanga City is Dr. Alex Rillo, the chairman of the Department of Surgery of the Zamboanga City Medical Center. I shall now ask Dr. Cirillo to introduce the audience in Zamboanga City. Dr. Cirillo.
Thank you very much, Dr. Rosan. With us here present at the Zamboanga City Medical Center is our hospital director, Dr. Rolando Bukoy. We have also here our chief of clinic, Dr. Almontuno. Then we have here our chief resident, Dr. Marisa Lim, our senior resident, Dr. Sammy Cristobal. We have also our junior consultant, Dr. Jimmy Liu, Dr. Hindan Kalumba, second-year resident, Dr. Jan Anakan, third-year resident, surgical resident, Dr. Joseph Chong, second-year resident, and Dr. Pablo Bula, a first-year surgical resident. That's all right.
Okay, thank you, Alex. I will now give the general format of the debate. First, there will be a presentation and clarification of the situationer and issue for debate. Then there will be presentation by the opposing proponents. Each proponent will be allowed a maximum of 10 minutes to present and discuss their stand in the issue. After the two opposing proponents have presented their views and analysis, there will be a rebuttal. A maximum of 5 minutes will be allowed for rebuttal by the team captain. The second round of rebuttal will be allowed. This time, only the other members of the team can do the rebuttal for a maximum of 3 minutes per team. The team captain is not allowed to say anything during the second round of rebuttal. Only the members of the team. After the rebuttal, there will be a reaction, comments from the resource person and the judge, namely Dr. Liquete. There will be a short open forum followed by closing remarks. Are there any questions regarding the general format from the Zamboanga side?
No questions from our side.
From the PGH side?
None, sir.
If none, I will now give the situationer and the issue. Can I ask Dr. Agno to go to the board and be the scribe for the PGH team? Alex, do you have a scribe for your team? The situation. A 40-year-old married female has a 2-centimeter breast cancer at the right upper outer quadrant, diagnosed clinically and cytologically by needle biopsy. The breast mass is 3 centimeters away from the nipple areolar complex and is movable. There are no palpable axillary nodes. Surgery will be done. The contemplated operation is some form of mastectomy and an axillary dissection. The issue is whether to do a total mastectomy or subtotal mastectomy. By subtotal mastectomy is meant a wide excision of the breast cancer with a 2-centimeter margin all around, preserving the nipple areolar complex. As previously agreed upon, the PGH residents will take the side of total mastectomy, while the Zamboanga residents will take the side of subtotal mastectomy. Are there any questions and clarifications as to the situationer and issue for debate from the Zamboanga side?
No question at the moment.
From PGH side?
None, sir.
If none, let's proceed to the presentation of the opposing proponents. First to present is the proponent for total mastectomy in the person of Dr. Carol Ann Paz Arcilia, representing the PGH team. Dr. Paz Arcilia, remember you're given only 10 minutes.
Good afternoon.